The power of stories, pros and cons in narrative exposure therapy. Narrative exposure therapy, NET, has gained attention as a promising intervention for the treatment of post-traumatic stress disorder, PTSD, particularly in populations exposed to complex trauma. This brief video will summarize some of the empirical evidence supporting NET and highlight relevant criticisms of the model. Empirical evidence. Randomized controlled trials and meta-analyses. A randomized controlled trial by Nuner et al., 2008, demonstrated the efficacy of NET in reducing PTSD symptoms in survivors of war and organized violence. Also, a meta-analysis by Robjant and Faisal, 2010, found that NET showed significant effectiveness in reducing PTSD symptoms across diverse populations, supporting its potential as a cross-culturally applicable treatment. Studies across cultures. NET has been studied in various cultural contexts, including regions affected by conflict and displacement. For instance, a study by Robjant et al., 2013, examined NET in refugees in the United Kingdom and found significant reductions in PTSD symptoms. Long-term effects. Some studies have suggested that the effects of NET may endure over time. In a study by Catani et al., 2009, the positive effects of NET were maintained at a one-year follow-up, indicating the potential for sustained therapeutic benefits. Comparative effectiveness. In comparative studies, NET has shown comparable or superior efficacy when compared to other trauma-focused therapies. A study by Kruger et al., 2017, compared NET to present-centered therapy and found that NET resulted in greater reductions in PTSD symptoms. Neurobiological correlates. Neurobiological studies have provided additional support for the effectiveness of NET. A study by Liddell et al., 2011, used functional magnetic resonance imaging, fMRI, to demonstrate changes in brain activation patterns associated with NET, suggesting neural mechanisms underlying therapeutic effects. However, there have been some significant criticisms of the model. Resource-intensive. One criticism of NET is that it can be resource-intensive, requiring trained therapists and extended treatment durations. This may limit its feasibility in settings with limited mental health resources. Re-traumatization risk. Some critics have expressed concern that the detailed narrative exposure in NET may potentially pose a risk of re-traumatization for some individuals, particularly those with severe PTSD. Critics argue that the potential for distress during the retelling of traumatic experiences should be carefully considered. However, I was unable to identify any research studies documenting actual instances of re-traumatization. Ongoing research on this issue may be warranted. Cultural sensitivity. The model's emphasis on detailed trauma narratives may not align with the cultural norms or preferences of all individuals. Cultural sensitivity and adaptation of NET may be necessary for diverse populations. Limited research comparing variants. While NET has been compared to other treatments, there is limited research comparing different variants or modifications of NET. This leaves questions about the specificity of certain components of the therapy. Generalization to different trauma types. Some critics argue that NET's focus on war and organized violence may limit its generalizability to other types of trauma, such as interpersonal trauma and trauma due to natural disasters. More research is needed to explore the effectiveness of NET across a broader range of traumatic experiences. In conclusion, while NET has shown promise in treating PTSD, ongoing research and critical evaluation are essential to address criticisms and enhance the model's applicability across diverse populations and trauma types. Additionally, careful consideration of ethical concerns and potential risks, such as the possibility of re-traumatization, is crucial in the implementation of this therapy. This video was created for educational purposes only and in no way is intended to offer psychological, legal, or medical services. If someone is interested in mental health services, they should contact a licensed mental health professional.